Cancer and nutrition. Learning outcomes. At the end of this presentation, the patient relatives knows the points to be considered in nutrition before cancer occurs. Gains knowledge about the changes that may occur in nutritional status during the cancer process. Learns the side effects of cancer treatment types and how to use a nutrition method against the side effects. Purpose of the module: to provide basic information about cancer and nutrition to sick individuals, their relatives, and health personnel. Nutrition for cancer protection. Among the lifestyle factors, such as nutrition, alcohol intake, obesity, and physical activity factors are considered to play an important role in the development of cancer after cigarettes. According to the World Cancer Research Fund American Cancer Research Institute. Being as thin as possible within the ideal weight limits. Eating rich in fruits, vegetables, whole grains, and legumes. Not consuming processed meat, such as ham, sausage, salami, sausage. Consuming red meat in small amounts. Limiting salt intake. These are healthy diet interventions that can be done to prevent cancer. Carbohydrates and cancer. Dietary carbohydrates are a diverse group of molecules, ranging from simple sugars to highly complex polysaccharides such as dietary fiber and starch, and are the main source of energy for most societies. The amount of carbohydrates to be consumed varies according to the individual's body weight, age, gender, and physical activity. Excessive consumption of simple sugar may indirectly increase the risk of cancer by increasing high insulin production and oxidative stress and causing obesity. According to studies conducted in Mediterranean countries, the use of refined flours increases the risk of stomach, colon and rectum, breast, upper digestive system, and thyroid cancers. Proteins and cancer. An increase in protein intake of animal origin brings with it an increase in the amount of energy. This is thought to increase the risk of cancer by causing obesity. Total red and processed meat, ham, sausage, salami, sausage, intake was associated with an increased risk of gastric cancer. It has been determined that the effect of processed meats is high in the relationship between the risk of pancreatic and colorectal cancer and the consumption of meat, which is a rich source of protein. In one study, a daily intake of more than 160 grams of red meat and processed meat was found to increase colon and rectal cancer risk by 35% compared to less than 20 grams of meat consumption daily. Experimental research shows that lean animal protein intake is not linked to cancer. In this context, it is thought that the intake of fatty meat and saturated fatty acids may be a factor that may increase the risk of cancer. For this reason, it can be said that the consumption of lean or low-fat meat, milk, and similar foods in the diet does not increase the risk of cancer. Fat and cancer. When the relationship between cancer prevention and dietary fat is examined, it is known that not only the amount of fat consumed but also the type of fat is an important factor. Studies have shown that omega-3, DHA and EPA, play a role in preventing cancer development. There is evidence that squalene, one of the hydrocarbons in olive oil, has a positive effect on the prevention of cancers, especially upper respiratory and digestive system cancers. As a result of various studies, it is thought that saturated fat intake may be associated with the incidence of breast, colon, and prostate cancer. The best way to reduce saturated fat intake is to opt for lean meats and low-fat dairy products and to use vegetable oils instead of butter. Dietary fiber and cancer. Vegetables, fruits, whole grains, and legumes contain fiber, a type of carbohydrate. Excessive intake of fiber prevents constipation, ensures regular functioning of the intestines, and can prevent the formation of colon-rectum cancers. In addition, high-grain fiber intake has also been significantly associated with a reduced risk of stomach cancer. Vegetable and fruit intake. It is associated with a reduced risk of lung, mouth, pharynx, larynx, esophagus, stomach, and colorectal cancers. Vitamins and cancer. It is known that vitamins, especially vitamin C, D, and E, have cancer protective effects. In the report on the relationship between vitamin D and cancer published by the International Agency for Research on Cancer, it has been reported that there is an inverse relationship between 25-OH-D levels and colorectal cancer and breast cancer. Naturally occurring bioactive compounds such as curcumin, a pigment found in turmeric, resveratrol, an antioxidant found mainly in grapes, and isothiocyanates in green fruits and vegetables, have anticancer activities. Carotenoids, lycopene, vitamin C, which are found at high levels in vegetables and fruits, and vitamin E, which are found at high levels in vegetable oils, oilseeds, legumes, whole grain foods, and green leafy vegetables, are also seen as components against cancer formation with their antioxidant properties. A diet rich in vitamin C may play a role in reducing the incidence of gastric cancer. However, dietary supplements should not be used uncontrolled unless recommended by a healthcare professional. It is recommended to supply vitamin requirements through food sources. Although the requirement and recommended amount in adults vary from person to person, it is recommended to consume at least 5 portions, at least 400 grams day, of vegetables and fruits per day, at least 2.5 to 3 portions of which should be vegetables and 2 to 3 portions of fruit. Alcohol and cancer. It is accepted that chronic alcohol consumption is an important risk factor for the development of different types of cancer. There is a strong association between alcohol consumption and an increased risk of cancer, particularly cancers of the head and neck, esophagus, breast, liver, and pancreas. The association between alcohol intake and breast cancer risk has been confirmed. It has been concluded that even a small amount of alcohol use increases the risk of breast cancer. Obesity and cancer. The risk of cancer increases in malnourished, sedentary, or obese individuals. Overweight and obesity can increase the risk of breast cancer, colon, endometrium, kidney, esophagus, pancreas, gallbladder, liver, and ovarian cancer. Studies show that conscious weight loss can reduce the risk of obesity-related cancer. Methods of food preparation, cooking, storage, and cancer. Cooking methods are as important as the type and amount of consumed foods. When high heat is used during cooking, some compounds that can cause cancer may occur. Not exposing foods to very high temperatures for a long time, avoiding overcooking, and removing the burned and darkened parts when fried foods are consumed are among the methods of preventing cancer. Using cooking oils more than 3 times will cause the oil to burn. Burnt oil contains carcinogens. When frying in oil, the number of carcinogenic compounds formed increases as the frying time increases. Microorganisms that can multiply in oilseeds, such as hazelnuts, peanuts, walnuts, cereals, dried fruits, and spices stored in humid and warm conditions can produce some toxins. These toxins, aflatoxin, are known to cause esophageal and liver cancers. Therefore, storage should be done under suitable conditions. Nutrition in the during cancer. Nutrition is one of the most significant aspects of cancer treatment. Eating by choosing the proper nutrients is crucial for the cancer patient to feel well before, during, and after the treatment. Side effects associated with treatments such as chemotherapy and radiotherapy, decrease in food intake, nausea, vomiting, food disgust, early satiety, constipation, diarrhea, malabsorption, mouth sores, and taste changes. Some such symptoms make it difficult or prevent eating. Weight loss is present in 31 to 87% of newly diagnosed cancer patients. Cancer cachexia, extreme weakness, can be seen in some cancer patients. Cachexia increases the tendency towards infections, especially due to the suppression of the immune system. Side effects of treatments for cancer and nutritional recommendations. Taste change and nutritional recommendations. Cancer patients often complain that food is tasteless. The presence of a tumor and cancer treatment processes both cause damage to cells that contain taste and smell. Good-smelling foods that the patient may like should be prepared. It should be ensured that the patient consumes the food he wants and prefers. Flavored foods such as mints and lemon candies can be recommended to the patient to increase salivation, unless there is a specific situation such as diabetes where sugar consumption is prohibited. Mouth should be rinsed before and after meals. Nausea, vomiting, and nutritional recommendations. Nausea and vomiting are the two most common symptoms associated with chemotherapy. Care should be taken to ensure that the patient's physical environment is clean and odorless. Meals should be taken little by little and often. Fluid intake should be avoided during meals. Care should be taken to ensure that the foods are particularly dried and fat-free. Cold and soft foods can be preferred. Excessive oily and sweet foods should not be given. Mucositis and nutritional advice. After chemotherapy, the entire digestive system mucosa can be damaged, and usually, the oral mucosa can be damaged. Grainy, raw, acidic, very hot, very cold, bitter, sour, spicy foods should be avoided. The patient should be fed soft foods. Alcohol, cigarettes should be avoided. Diarrhea and nutrition advice. It is the observation of an increase in the liquid content or amount of stool, different from the normal form of bowel habit. Consumption of pulp and hard food should be reduced. Plenty of fluids should be consumed. Grain cereals, nuts, fatty foods, fruits with high acid content such as oranges and tangerines and their juices, raw vegetables, bitter, spicy and gas-producing foods, and alcoholic beverages, which can stimulate and irritate the digestive system, should not be given. Fat-free cheese, yogurt, rice porridge, banana, peeled apple, ayran, fish, chicken, boiled potatoes, white bread are recommended. Constipation and nutrition recommendations. Some painkillers used for pain control and inactivity are factors that cause constipation. In this case, high-fiber foods are recommended, vegetables, fruit, whole grains, etc. Fluid intake is increased. Regular physical activity is recommended. Neutropenia and neutropenic nutrition. Treatment types such as chemotherapy, radiotherapy, immunotherapy, and hematopoietic stem cell transplantation, which are cancer treatments, may cause neutropenia, and neutropenia may pose a risk for severe infections. An absolute neutrophil count of less than 2000 mm³ indicates that the patient is in neutropenia. In neutropenic patients, neutropenic diet practice to prevent infection has an important place. Recommendations to consider in the neutropenic diet. The expiry dates of the purchased foods must be checked. Care should be taken to store the food at the temperature indicated on it. Any food that is not sure about its content should not be consumed. Packaged products must be washed before unpacking. Hands should be washed before and after touching food. Foods sold in the open should not be consumed. Care should be taken that the cooked dishes are cooked once and consumed immediately. The water used while cooking food must be sterile or boiled. Unpasteurized milk and dairy products, raw or undercooked meats, tofu, pickled fish, foods containing raw eggs, raw grain products, unpackaged bread, cream pastry products, unwashed and unpeeled raw fruits, unroasted raw nuts, unpasteurized fruit juices, dried fruits should not be consumed. If the neutrophil count is below 1500 mm³, raw vegetables are excluded from the diet. Nutrition therapy administered by dietitians reduces the length of hospital stay and costs and can increase the quality of life by ensuring that the patient is affected by the physical and psychosocial aspects at the minimum level.